Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Question. True about thiopentone sodium. Thiopentone sodium. True statements. 1. Fast recovery. Thiopentone sodium is responsible for fast recovery mainly due to the recirculation of cerebral redistribution. Due to redistribution, there is fast recovery. It is true. Thiopentone sodium causes laryngospasm. Yes, it causes laryngospasm, has side effect. It has tendency to cause post-operative discomfort. This is true. And fourth statement is the stage of delirium is absent. False. The stage of delirium is present in thiopentone sodium. This is false. In any anesthesia agent, the stage of delirium is present. So thiopentone sodium may cause restlessness, vertigo, and euphoria. That is the stage of delirium can occur, though it is rare, but it is present.
thank you and thank you for watching.